The next step in the COPC, so once you define your neighborhood, is to find out what's going on. Well, usually a researcher or a doctor presumes they know everything, right? That's what the white coat's all about. It's a uniform of, I know everything. And you in the exam rooms, the patients respond to that by telling you what they think you want to hear. So you never know what's going on, because they'll only tell you and parrot to you what they think you want to hear. So you have to ask the community, if you're really going to know what's going on, you have to ask them. And you have to do so in a non-threatening way that's open for truth-telling. Because you could go to the Department of Public Health and say, hey, what are the top 10 diagnoses for this zip code? You go to the emergency room at St. Mary's. What are your top 10 diagnoses for visits from this zip code? You can go to the state and do the same thing. You can do any number of database searches and get demographic health information for this area. But those aren't necessarily what the population's into. And so, unless the population is turned on about a certain health problem, they're not going to be all that attentive to it. And this is a huge fallacy for researchers. Because, for example, if gun violence is your shtick, and you go into a neighborhood after, you write a big grant about gun violence in 53212, and you get a big grant and a bag of cash and all these preconceived activities and benchmark outcomes that you're going to make and a timeline that's fixed. You go into the community, you start preaching the gospel of gun violence, you got the money, you start hiring people, you start doing a campaign, start mobilizing, all this rah-rah, and you start collecting your data, and at the end of your grant, the money runs out, and you pack up, and you leave, and you're off writing your paper for your publication, and you know what? That gun violence goes right back up, because the community was never invested in the problem. They bought into it because you had money, and you had all that sex appeal that comes with money and authority and all that good stuff. But the reality is, it wasn't their problem. It was a problem you identified. So, what you have to do is get the problems that the community is into. And that's no easy task, because it takes a lot of shoe leather and a lot of patience, and nobody's willing to pay for it. So yeah, a researcher has to do it on their own. And that's one of the sticking points of community-oriented primary care is it just takes a lot of self-time. Nobody wants to give that. We're all busy. We want somebody to pay us for our time. You know, if you're going to work outside the exam room walls, you have to give a little. And so this is sort of, as I refer to as priming the pump. Okay, you go out and you start listening. And doctors like to talk. And so you just start listening. You keep your trap shut, and you let people tell you what's going on in their minds, even if it sounds half-baked. You know, many of the people you're going to meet are far less educated, far less resources, far different viewpoint of the world perspective. Yet, you know, for what it's worth, their credibility on the street is a lot more than yours. So, interestingly, we did that to River West. In a very scientifically sound manner, we did a nice survey, and it really looked at some of these social determinants. And you know what they told us? They said they're hungry. Hello? I never learned in medical school to ask a patient if they're hungry or not. You know? I mean, sure, I learned about nutrition and all the fat-soluble vitamins and water-soluble vitamins and all that crap. But hunger. I mean, let's just think about how corrosive that is on a person's health. A kid who's hungry isn't learning. What happens? Then they don't advance, or they don't get their degree, or they don't get into the college. And then they end up in a lower wage job. And you know what? Income and longevity are tied 1-to-1. If you're a low wage earner, you die early. A high wage earner, you live long. It's a pretty simple relationship. So right there, that's a pretty big impact on health. Number two, let's say you're a parent who's hungry. You're more irritable. So you're less of a likely to be a patient, fun-loving, all-around house person. You're more irritable, ready to shout back, you're more ornery, you're less of a lover, so you can't be a good spouse and a partner, a good parent. You're not happy. And then when you do eat, you're cash-strapped, and so you grab a bag. You're eating out of a bag. And that's, as you know, a calorie-dense way of fulfilling a need to be full and stave off that hunger, but it's lousy for this whole problem of disease expression, the obesity, depression, and everything else that flows from fast food. We do know from our research that African American urban dwelling women, their obesity is linked to food scarcity. You know, we always think if you don't eat as much, you won't gain weight. Well, if you're so fat, you must be eating like a pig. All right? No. Food scarcity, food skipping, actually begets more obesity. For African American women, anyway. We're looking at the other genders and racial groups. So, they told us they're hungry, and this is a pernicious issue. So, they also told us that they're mentally stressed. Okay? Not necessarily diagnosably DSM-4 depressed or DSM-4 anxious, but just at the level where they're not happy campers. So then what happens? Again, it feeds into this whole, if I'm not a happy camper, you're not a happy camper, because you and I are living together, you know, or I'm your parent, or what have you, or I'm your employee, or I can't study because I'm just irritated. I'd rather go, you know, do something else. I'm working 2 jobs, I'm eating out of a white paper bag, I've got kids that are underfoot, I can't pay the rent, you know, I'm stressed out. And I think we see that all the time. And so, how do you work with that? Because that, again, is a corrosive aspect on a community's health. They told us that they have security issues. They're looking over their shoulder. Now, we've had some high-profile violent crime in the neighborhood. There's been a number of shootings. Some of them have been random senseless. So that almost is even more unsettling. It's like, oh my God, if it can happen to that person, it could have been me. I think we all take some consolation in a gangland shooting, if there's going to be one, saying, oh, at least it was targeted. I'm not involved with that, they won't come after me. But, you know, these random things, like there was a delivery guy for Jimmy John's who was shot last winter. He was a UWM student. He was delivering a sandwich, and bam, a botched robbery, and he was killed. So the neighborhood's sort of unsettled. And how do you feel good about your neighborhood if you're looking over your back? You don't know your neighbors. Again, another corrosive aspect of a person's wellness. How do you go out and exercise? How do you let your kids be kids? How can you feel good about letting them run loose a little? And lastly, they told us, not unsurprising, is access. They have access issues to seeing their physicians. But what was surprising is not the insurance issue, because that's a gimme. We have an insurance crisis in this country. And about a third of all River Westers go without insurance, at least part of every year. But what they told us is they have transportation issues. I'm sitting in my clinic. I've got a booked schedule. The people that come and see me have figured that one out for themselves. I never think of transportation, because I'm not seeing the folks that have transportation issues, right? I'm seeing the ones that don't have transportation issues. Again, it's a silent epidemic. The people that have a problem can't be counted. So, if you're going to heal the community, you've got to ask the community what's going on with them. That's point number 2. Very often, totally ignored. So, define your population, ask them what's wrong with it. Thirdly, ask them what they're going to do about it. Their problem, their solution. As a doctor with the white coat, I want to be in charge, right? I'm taught the whole time I'm in school. I'm the top of the team. I'm team leader. That's what we always say around here, team leader. You cannot be in charge of a problem that's not yours. My solution to their problem would most likely miss the mark. And again, as soon as I move on, my solution would stop. As soon as there's a end of cheerleading, the solution ends. So you've got to figure out a way that it's their solution so that they incorporate it into the fabric of their neighborhood. So that after you leave, it continues.